Good morning, everyone. Welcome to join our seminar today. My name is Chen Gao. I'm a professor at the Columbia University School of Social Work. I also direct the Columbia China Center for Social Policy. Welcome to the fourth lecture in our annual lecture series titled Chinese Social Policy from Comparative Perspectives. This lecture series is co-sponsored by the Columbia China Center for Social Policy and the Weatherhead East Asian Institute, and supported by the Columbia School of Social Work. Our speaker today, Professor Chen, welcome to this program. He is an associate professor of health policy and economics at Yale University. His PhD in applied economics is from Cornell University. Professor Chen's research focuses on improving public policies on population aging, life course health, and global health systems. He is also a consultant at the UN, a research fellow at the IZA Institute of Labor Economics, and former president of the China Health Policy and Management Society. His research has won many awards and has been reported in global media. We have not met in person, but we have communicated via email and other outlets. So it's a great honor and pleasure for me to welcome Professor Chen here today. He will be talking about something very fascinating, how educational policies might impact health aging in China. Over the years, I've talked to many scholars who study education policies in China, aging policies in China, now the two linked together. So today it's our treat to listen to Professor Chen to share his new research findings. Welcome, Professor Chen.
Thank you so much, Professor Gao, and it's a great pleasure to give a talk about our current work and some ongoing work with regard to education and healthy aging in China. I will draw also evidence from some other countries as appropriate to enhance the argument about the observations we have from our study. And so the title is education, or you can say education policy and healthy aging, because lots of the variation in education attainment come from the policy change. And we will draw some evidence and also make use of some natural experiments in China and summarize some of the education policies in other countries. So first I will introduce the importance of this topic, and I will spend some time talking about the identification strategy, because we want to not only looking at the association between education and healthy aging, and but looking at some causal implications in the hope of getting closer to the policy debate. And then we will introduce the data variable and the results discussion, and finally discuss some mechanisms. And today is a great time to actually talk about this issue, because you will see our latest evidence shows how important the family support is towards parents' health, especially cognitive health we are looking at. And today is the Lantern Festival, so happy Lantern Festival. And in Chinese tradition, Lantern Festival is the last day of the Lunar New Year before the kids go back to their workplace. Lots of migrants will go back. So the parents will resume their more lonely life without substantial care of the children. So I think it would be a good timing to talk about education policy towards the parents, the children, and the family support as regard to their healthy aging process. I would like to start with this interview. Since Professor Gao mentioned my affiliation with China Health Policy and Management Society, a couple of years ago, 5 years ago, we interviewed Mike Grossman, who is a pioneer, the founding father, one of the founding father of health economics. And he is also the major expert in studying education and health. And we had an interview with him representing our society. And during the interview, he emphasized several times about the importance of education and health. And I just quote some of his words: despite the large body of recent research to which I have referred, there is no consensus as to whether more schooling does in fact lead to better health and beneficial health behaviors. Will a definitive answer to this question emerge in the not too distant future? If so, will it be viewed as a major breakthrough, one that is worthy of the Nobel Prize in economics? I'm not sure. My sense is that the issue may never be resolved because ultimately it may depend on context, time, place, and many things. And he mentioned several times, and this interview is downloadable from our society's electronic journal, China Health Review. If you are interested, please take a look. So that I use Mike Grossman's words, quotes to start this talk. So before we go to talk about specific policy, so in the last couple of years, my research team at Yale has been working on some aspects of education and healthy aging, looking at the different health outcomes. I just want to summarize what we found and which led to what we are working on now. So first, we look at how education and other life course determinants drive the healthy aging. And this study we published in Age and Aging was looking at frailty. And frailty was measured in 5 aspects: the unintended weight loss, feeling of exhaustion, weakness in which measured by the grip strength, a slow walking speed, and the low levels of physical activity. And in that study, we showed that individual educational attainment was very strongly predicting the not only the frailty status, but the pre-frailty. But that study and a couple of studies we did before and after was mainly based on the kitchen sink approach. We usually use this term in my causal methods course at Yale. We teach students causal inference, but those studies are different style because we are controlling for all kinds and all aspects of life course to look at each of the of all factors that may have impact or have association with healthy aging. Before we come to the conclusion of causal effect, this is one of the first initial steps to look at how education matters. So you can see those highlighted area. So people with primary school compared to people with a college degree, and they are more likely to have a higher risk of frailty. And there is a clear gradient of educational gradient of frailty. And in another study, I think that was very exciting. We integrate the genetic data for the children and link to their old age health. And also we have rich information about their life course factors. You see that we classify all these life course factors into a bunch of domains. And the adulthood SES was mainly measuring the children's, when they become adults, their educational attainment. And we found that, and we construct a measure of phenotypic aging, which comes from 9 out of 42 blood biomarkers. And this is using American sample. And we did some decomposition and other analysis, and which shows that around the 5% of variations in old age in terms of phenotypic aging can be attributable to the variations in how the educational attainment. Not only about the education level, but also we also look at the genetic data and the PGS data, which can give us some sense about some genetic factors associated with education cognition. Those also explain part of the the variation in phenotypic aging. So adding the educational attainment and the genetic factor regarding education and cognition together is around 5% of variation in old age being explained. And the phenotypic aging, for those of us who are not quite familiar, is a measure of your phenotypic age. So for example, chronologically, for example, we are 50 years old, but your body may suggest, your blood biomarker may suggest you might be like 55, which means you are 5 years in advance to your actual age. So if that's the case, that we say we measure it as 5 years advanced aging. So, but some of us are having a slower pace of aging. So in the blood biomarker measure, it may turns out to be that some individuals have a phenotypical age to be like 45, which is 5 years younger than their actual age. So it's a variation around the actual age. And most recently, there's a Lancet report. It's not a causal study, I would warn here, but it measures very rich dimensions of life course factors starting from education attainment and link that to dementia. And looking at how much variation in dementia in old age can be attributable to the factors throughout the life course. I mean, throughout the life course here means starting from completion of education. And you look at, there are so many factors coming out as the most important factors, even hearing loss, traumatic injury, hypertension, and in later life, and they have social isolation, all those aspects. But they start with educational attainment. So which we thought might be a little bit late, because when we look at the cognitive health, normally the brain development was the most rapid in early childhood. So by the time of the completion of education, much of the traumas much of the issues with cognitive impairment later in life could be determined according to more and more such evidence. So that's why in a most recent study, we did starting from last summer, we look at, this is also American evidence, we link the genetic data, childhood circumstance data with the dementia incidence in later life. And we try to look at, this time we look at the Black Americans, white Americans, how much of the variation in their dementia status can be attributable to things happen before the completion of education, up to that. And we consider very rich factors at home. For example, their mother's time engagement with the children, father's education, their job opportunities, even housing type, different measures of family assets, and crime rate, and the local community environment. So, but one thing really stand out among all these factors, no matter we measure the variation in the cognitive score between whites and blacks, or the cognitive impairment, or the dementia across those two groups, one thing stand out, which is the own education. The children's education is the top one, most important thing. And we followed up, the survey followed up those older persons about around like 10 years on average, and some of them will even follow up about 20 years. So no matter whether we look at the earliest cognitive assessment and the cognitive impairment or dementia assessment to their most recent one, which could be like 10 to 20 years apart, the years of education still stand out to be the most important one. But very interestingly, not only own education, but parents' education also matters. And parents' education together with the parents' time spent with children, number of books at home, those are the very important factors in very early life that drives the variations across blacks and whites in their cognitive impairment status after more than 5 decades, 6 decades. So that was our finding. So which lead to the summarization of the current literature. So far in the literature, so many studies look controlling for very rich factors to look at different dimensions of life course factors, how that affect aging and different dimensions of aging. And the look at after controlling all these things, how education matters. And also they look at, including another studies, we are still under review with my PhD student, Lin Zhuar, and we look at how education may moderate the effect of early life factors. But those type of studies look at the rich factors at the same time, but check how education may make the difference in mediating the early the divergence of the childhood environments. Later on, more and more studies looking at more concentrated looking at education, the impact of education. There are three strands of literature. One is looking at own education, own health, like Michael Grossman's quotes. He was mainly mentioned about the own education effect on own health. But also there could be like upward and downward effect of education. For example, if we look at how parents' education affect the children's health, that's more evidence, empirical evidence for many countries there. And also people looking at own education affecting spouse education. So we say the first here, the bullet point shows a large number of studies looking at own educational health. Some exceptions are looking at parental health on their children's education or spouse education, but very few are looking at upward effect. There are some exceptions there. So I mentioned at the end some of the exceptions, but most of those studies are linking children's education, parents' health outcome, but they are not distinguishing the causal effect from the pure associations. I would like to note here that there are two works closest to ours. One is published by Ma Mingming from Shanghai University of Science, Finance and Economics, and she was looking at China, very close to ours, and we used the same data. And her work was looking at a very wide spectrum of health outcomes for parents. And she also looked at the compulsory education law in China. The difference here is that we look at a family arrangement within each family. So this is one of the things we differentiate. And also we try to focus on cognitive aging because we think a lot of things are unknown. We cannot judge about cognitive aging only by the score of the cognitive assessment. So that's why we did further work to look at different dimensions of the aging process. For example, the level of the cognitive deficit and the cognitive trajectories. And most recently, I just noticed this when I was having a conversation with Ma a few days ago, and she was also looking at published in Demography just last month, looking at Mexico. In that study, they look at some within family arrangement, looking at how children with different education may affect the parents' health differently when they have a different level or attainment of education. And their finding, they shows that the highest educated children matters to their parents' health, which will be different from our finding for China. So we will discuss this later. And most of those studies I have been talking about focusing on one aspect of health, which is mortality, longevity in old age, which is understandable because the longevity measure is usually the most accurate and the straightforward information to connect from different samples, different data across countries. But we need to understand more about other aspects of aging. So although we have a big title today about education and health, healthy aging, but we want to focus more on cognitive aging. So talking about the cognitive aging, you will see here, This is from American survey. I think it's very surprising to show that although this is only for women sample, and the report their care demand as well as the care they actually received across different types of diseases, conditions. And you will see that one standing out pattern is that the memory issues was not addressed. Lots of older persons have a problem with the memory, but the problem is not addressed by their physician. So cognitive aging is probably one of the most important health issues unmet, unaddressed. So we will focus on cognitive aging. And talking about cognitive aging, there's growing rich evidence about the impact of cognitive functioning in older life. As we know, as we are getting older, we are accumulating more wealth. We need to make very important decisions, how to spend our lifetime savings, how to make these decisions when to retire. In American setting, if you retire a few months earlier than optimal retirement timing, you could lose up to 1/3 of the retirement income. And also how to making decisions about the health insurance. And for example, Medicare Part D has so many drug plans, pharmaceutical drug plans. And if you are choosing the less optimal plan based on your disease portfolio, you could be losing about a couple of thousand US dollars each year. So those are very important decision making, and the portfolio diversification very important. But cognitive aging is associated with unable to do so. And there are growing evidence and mistakes about using credit cards. Just a couple of months ago, the JAMA Internal Medicine was publishing a paper looking at when people who were diagnosed with dementia and how they affect their decision making. What's very strong evidence and astonishing from that study is that they show that up to 6 years before the diagnosis of dementia. So at that time, people still had only mild cognitive impairment, but they started to default on their credit card. And lots of decision-making errors occur a couple of years before the dementia. So that was very much a strong and important finding there. And also cognitive aging is affecting health and well-being. 50 million people live with dementia worldwide, and this number is growing no matter in China, in the United States, although the prevalence is becoming lower in recent years in America, but in terms of absolute number of people with dementia is increasing. And the economic impact is huge. So the global burden of dementia is estimated to be over $1 trillion US. 5 years ago, the New England Journal was publishing a study showing, using the survey data, HRS, showing that in America alone, around 150 million 115 billion US dollars was spent on dementia patients, including three parts: in informal care, the healthcare costs, and also the nursing home costs. And this number is rising very quickly. So there's a large demand in addressing the issues of cognitive aging. And here, I just draw your attention to the two recent studies showing the prevalence rate in China about people with Alzheimer's disease and related dementia. And the right figure shows the exact number of people. You see that the darker color means that more people are suffering from to the level of dementia. But since those areas have more population, so in terms of prevalence, it's lower. We recently work on a few thousand hospitals data in China. We haven't done with the data analysis yet, but we also show that the disease burden was concentrated. I mean, disease burden in terms of the hospitalization for dementia patients in China were concentrated not to the East Coast, most developed area, but very much similar to this prevalence map, showing that Western China, North China, Northeast China was bearing those major burden there. We hope to release our results soon about the hospitalization of ADRD, the Alzheimer's disease and related dementia patients in China later this year. And this also shows two figures. One is the dementia patients, the prevalence rate over age cohort is increasing. That's not surprising, but we should focus on here. This is the people with MCI, the only very early stage of cognitive impairment. You see the cohort size is huge. Around 18 million people in the age 60 to 69 have the somewhat cognitive impairment status. And you see that this is so early, right? About just about age 60, and when people really need to have strong cognitive functioning. And this number is reducing because the cohort size of the population, but still it accounts for a large number of Chinese older persons. So the overall prevalence about mild cognitive impairment, MCI in China, was estimated to be around 15%, and which is about 38 million Chinese population, and is increasing with age. So this is before the onset of dementia. So we really need to pay special attention to those people who are not using the healthcare resources, but who already have a large issue with their daily life, their decision making, their quality of life. And this shows the same figure for dementia and MCI by the gender. And we see that females are having a more higher prevalence rate of MCI. But if we look at the in-hospital, the hospitalization data, you will find the opposite. Males are using more of the service than females, but this is not a topic for today. But I would just want to show that if education may have an impact, no matter children's education or their own education, if the impact is larger for females, that would be a good news. So that's why in the analysis, we also try to look at the gender difference there. And the last pattern for this by age group and sex, and here is by rural and urban, sorry, the typo here, the rural and urban area. So you see that the rural area, people suffer more from the MCI than urban area. And we today we will use compulsory education law to look at the Alzheimer's disease and related dementia. And we know that compulsory education affects rural people more, as their trend and the status of educational attainment before the reform was lower. So this should have a larger impact for them. So it would be interesting to look at whether those education reform to give more education could shrink the gap between rural and urban in terms of their MCI or dementia prevalence. And how to identify the causal effect of education. There are some, as I mentioned, many of the studies just look at the association. And sometimes they look at the year of education and how that be associated with any dimensions of health. Sometimes they are even more have just a distinction between the literate and the illiterate to look at how people differ in their literacy in terms of their health outcomes. And the finding is very much mixed. I just raised an example of a measure of the trajectory of cognitive skills by education or literacy. And you see 3 studies find totally different things. Some find that people with high education, high literacy, with lower education, lower literacy people, they are diverging trend when they are getting older in terms of trajectory of cognitive skills. Some people find largely parallel trend, and some people find the convergent trend. Those are all from the American study. but they find very different results. So it makes sense to look at the causal effect of education, what really education may affect cognitive aging. And also there are three challenges, meaning in very standard econometrics that may affect the causal linkage between education and health. For example, it could be healthier patients being better able to invest in children's schooling, so which is reverse causality, and also some omitted bias or variable bias may bias the estimates. For example, unobserved genetic or environmental factors that could lead to the health and education decisions of both parents and children. So which determines both the X and the Y. So if we are not able to address the omitted variable bias, so the estimates will be much biased. And also there's a classical measurement error, like years of education, because in most surveys, education were self-reported. And in some different provinces in China, education was reported, and the primary school even have different years. Some areas have 5 years, some 6 years. So reporting of years of education may suffer from measurement error. So it's important to use natural experiment combined with some econometric techniques to address this issue. And I just skipped this. There are different pathways, causal pathways linking education and health. Specific to this study, besides that education can offer knowledge and cognitive skills that improve health, education may also improve cognitive health through brain reserves, which may strengthen the brain reserves to protect against the cognitive impairment, no matter whether themselves or their parents. So that's another channel, but there are many more. In the literature, you find there start to be a growing number of articles using educational reform to look at health outcomes. For example, looking at France, Sweden, there are education reform that increased education level. And there was a UK educational reform also being started. For example, they have a change in the minimum school living age in England back to 1947. They extend the minimum school living age from 14 to 15. So which has a long-term impact on the education attainment for children in England and their long-term outcomes. So some studies, James Banks had a paper looking at when they are getting older, how that affects their cognitive health. And in the US, there are many more things. States have their own compulsory education laws. And also we know that school enrollment in American often based on their date of birth, which can be used to draw causal implications to look at children born just before January the 1st or after January 1st as an example. So which give them other natural experiments to look at this causal impact. There are many more, like more studied. I was doing a search from the IZA, where I'm affiliated with their discussion paper over the last 20 years. Several papers looked at Turkey and the compulsory education law, how that affected people. But very few studies link that to old age person, but they look at the labor market. Also in Indonesia, they also had a 1994 a 9-year compulsory schooling law that extend education to many people. But very few studies looking at intergenerational effect of children's education's promotion on the health and cognition of their parents. So this is as an integral part of the social network of parents, children can extend a very large impact. For example, through different things I list here, and we also tested each of them later on. The provision of social support, access to resources, social influence, changing their health behavior, lifestyle, emotional support, for example, through their informal care, stress events, and other things like the labor depleting activities. When parents get more support from more educated children, how they change labor supply, especially for blue collar workers, may have a positive impact on them. And maybe they are reducing their care for grandchildren because they are more independent economically, and maybe they do not want to co-reside with their children anymore, because if we value living as privacy as a normal good, when parents becoming richer, maybe they can afford to live independently. There are so many channels we discuss in our this ongoing study. And what we don't know is also that within family arrangement, if you have 2 kids or more kids, how they arrange the support in those dimensions. I will briefly introduce our results. So the main gap here is in Mars paper, they find the recent work demonstrate that increased schooling of children can lead to better cognitive outcomes of parents. And they look at a greater mental intactness and episodic memory, but limited understanding on how children's education affect the parents' cognitive status and the trajectories. So the findings are pretty much mixed. Education may lead to a higher level of cognitive reserve, but there's no consensus about how they change the rate of decline. The rate of decline of cognition is very important. As I mentioned, the study on the default on credit card score, credit card payment, when the patients were first having a decline in the cognitive status, and if that signal was not captured early, then it will delay the diagnosis and the treatment. And also in our most recent study, we look at American setting. I didn't mention here, we look at American population, a sample of American older adults, and looking at their changing cognitive status, like cognitive decline, how that affects their cognitive diagnosis. And we show that this is very important to capture the signal of not only the level of cognition, but the change in the cognitive status. If we can be able to capture that early signal and we do the diagnosis, we can make better arrangement of the life. And we show in American sample, we published in Journal of Gerontology recently, we show that with those signal and with diagnosis, they can make better decisions. But we see that in the population, there are so many divergences in their response to the cognitive decline. Most of the minority groups are not responding to decline in cognitive diagnosis. Could be because of the economic concern, because of the stigma associated with the diagnosis, many things going on. So looking at additional dimension of cognitive aging, the trajectory, the decline pattern of cognitive diagnosis, cognitive status is very important. And both dimensions are important precursors of cognitive impairment. We need to think about both. And very importantly, since cognition is so much related to education, so it turns out to be that lower educated people really have a trouble with cognitive tests. So they may have a low level of scores, but low level of scores doesn't mean that it's cognitive impairment. So we need to check whether there's also a early stage of but fast decline of the cognitive status. That would be very important. So that this paper, we look at the status as well as the trajectories of the parents' cognitive aging. And we look at comparing children high educated, low educated, how they make arrangement to take care of their parents. And in the interest of time, we do not present other results we look at. For example, by their birth order, older sibling, younger sibling, they may do differently to their parents to coordinate. And also they may have a different effect on fathers and mothers. And we discuss the mechanism, which very briefly, compulsory education law in China back in 1980s give more education to the extend basically primary schooling to the junior high, 9 year to before the junior high school. So throughout the country, but the timing of the experiment is very different. So you see here that it varies much across provinces. And also it varies by rural and urban residents, because we know many studies already show that the compulsory schooling law, not only for China, but many countries, is more binding for areas with lower education before the reform. So that makes sense, because with a lower starting point, so with the same level of enforcement, it would have to be stronger for those with a lower level of education attainment before the reform. So that's why we make use of across province variations in the timing of reform, as well as within province and rural and urban variation in the reform. And so just briefly, how we construct this measure. So if the child is already 15 years old, which is the completion, the year, the timing when they should complete the junior high school, right? So if that's the case, then the children, that particular child will not be affected by the reform because they already finished the schooling, right? But on the other hand, for children, so this is for those already finished the schooling, is this part. But on the other hand, for children just 6 years old or before 6 years old, when the policy kick in, so that means this child will be fully affected by the policy. So you will see that their percentage of completed education later on will be much higher. But many children are in between. So for example, they are 10 years old, they still have 5 years to do their education. So the policy will affect them. So it will be in proportion to their in their age. If their age is closer to the completion of junior high school, that means their effect is lower. So the variation you can say from their age in comparison to the cutoff age 6 and age 15. So that's the instrument we construct. And we can skip this. And basically, we estimate the children's education as a first stage using the timing of education law in China, and the timing of education law times the pre-law educational attainment at the province level by rural and urban. So the variation could come from the cross province variation in the educational in the implementation of the education law, as well as the variation in pre-compulsory schooling law at educational attainment at the provincial level. And this is those two are the IVs to predict, instrument variable to predict the children's education. And in the second stage, we look at how children's education affect Y, which is cognitive aging of the parents. So that's what we do, and we use the 3 waves of CHAOS, China Health and Retirement Longitudinal Study. And I'm sure many of you already are working on this data and are familiar with this data. So the variable of interest is the education of the children and also the parents' information. And we have rich control of demographic characteristics of the parents, the characteristics of children, and regional means the provincial level characteristics. We control for some infrastructural and health infrastructural, educational infrastructure. So the cognition are 2 parts. We look at the mental intactness, which is a measure of those things things people learn in early age. For example, very simple, the serial 7th test, successive subtraction of 7 from 100, orientation test, and the picture redrawing. But episodic memory is something freshly new. They learn, and they learn from the surveyor. The surveyor was giving some words, and they did immediate recall and the delay recall, which these 2 items put together will be episodic memory. And we reverse the code because the larger the higher the cognitive score, the better the cognitive status. In order to look at the cognitive impairment, aging, so we reverse the code. The higher means the more likely to be the cognitive impairment. And very briefly, we try to look at different dimensions of cognitive aging. So that's why we decompose that into the level of the deficit of cognitive aging. So the higher level of deficit means that the more chance of cognitively impaired. And also the second dimension is the rate of decline, which measures the trajectories. Since we have 3 waves of survey, we are able to check for each individuals, their rate of their trajectories. So it will be giving us the measure of the level as well as the trajectory. And this is summary statistics for the variables we controlled. And I just want to highlight that you see that the parents' education is on average 4.9 years. For children of the highest educated child, it's like 10 years. It's about 6 years gap. And there are also some years of gap, 3 years of gap between the highly educated and low educated. I will show that later. Those are the regional characteristics we control, the health infrastructure, education infrastructure we control in the regression. And the first stage of no doubt is strongly predicting like education law and pre-law education status in the province is strongly predicting the individual level, the children's education, years of education. And then, as we mentioned, we decompose into 2 dimensions. One is the cognitive deficit. See, here's the mean standard deviation. And also we look at the change, which measures the trajectory. The steeper the slope means that if the number is higher, that means the slope is steep, means the cognitive decline is faster. And here shows the benchmark result that no matter the result shows that education first of the highest educated child will delay or the cognitive aging of parents, no matter whether measured by the level of the cognitive deficit or the rate of the change. But the effect is stronger on the deficit, the level of the cognitive deficit. But there's a smaller effect on the change, the rate of change. So the trajectory is less affected than the level. This is the key message from this figure. And very importantly, since we talk about different cognitive assessment, so there are mainly 2 categories, right, of intelligence or cognition. One is crystallized intelligence, which is about people's existing cultural knowledge-based facet of intelligence, like seven subtraction. Those type of things already learned is becoming part of the knowledge and the culture in people's mind. And the other is more fluent intelligence, which is based on like freshly new learned things like the word recall, no matter it's delayed and immediate. So in Charles, those questions can be classified into these 2 patterns. And we know that cognitive aging is more about the fluid intelligence. So let's say whether fluid intelligence can, the aging of the fluid intelligence can be more delayed by this by this educational attainment of the children. Here we find that the level of cognitive deficit is affected much more than the rate of change. That means education of children may slow the aging of crystallized intelligence more, but still have limited impact, although it's significant, but limited impact on the fluid intelligence. So that's what we find. And in discussion, 1 year increase in children's education can lead to 0.17 standard deviation decrease in the level of cognitive deficit, which is similar to Mars result. But we newly found that the impact on the trajectories of parents' cognitive aging is also significant, although at a lower level. And I think the most interesting part is the discussion about the mechanism. So I think this is what we are building upon previous literature. We look at more educated children, less educated children. So first, let's say that high educated children, as I mentioned, have on average 3 more years than lower educated children. Many of them are exposed to educational reform, but high educated children tend to receive, since our classification, they are more educated, receive more years of education, and they tend to be younger, and their birth order is lower. That means they were later born than their lower educated children. So there are some difference in their birth order and other things. So that's why the subsample analysis by children's birth order may also have some impact being mixed with the year of schooling difference in different children. Yeah, and in terms of age, we see that the lower educated children are a little older than the higher educated children. So the results show that, the main result shows that the education of the highest educated children are having a larger impact to delay the cognitive aging of the parents, measured not only by the level of cognitive deficit. So, and we standardize into this effect size, 0.22 standard deviation. Standard deviation delay in the level of cognitive deficit of parents compared to 0.15, which is a little bit smaller, but still lower educated children have a strong impact to benefit the parents' cognitive aging. This is the evidence from China. So I was mentioning another paper published in Demography on very recently on Mexico. They only find the impact for the highest educated children. But in China, no matter highest or lowest educated children, they both are benefiting the parents in terms of their cognitive health. And in terms of another dimension, the trajectory of cognitive decline, we still say that both children benefit their parents and delay their trajectory of cognitive decline, but the effect is slightly larger for highly educated children. That's and before we finally discuss the implications, here we also look at the mechanism, potential mechanism. For example, there are so many things can be explained why parents' cognitive aging is slowed down. Probably, for example, because of living arrangement, emotional support, financial support, healthcare, access to resources, whether children spend more on their expenditures, parents' expenditures, or they provide infrastructure, or they provide more informal care, help their parents with their decision making, like pension enrollment. We have a separate paper to show that if there's, we published in Journal of Economics of Aging last year, showing that if there are at least one child are living not far away from the parents are more likely to enroll in the pension. And the social pension I was study is more non-contributory pension, is money on the table. So if children are all living home and far away from home, they are not assisting their parents in making those decisions. But if there are children around them, so the decision making can be much better. And also the parents may have a difference in their caring for grandchildren once they receive more care, or they receive more financial transfer from their own children. So we look at each of those things. That would be a lot of figures, tables, but I just want to summarize that we can classify all those support from children to parents into two major categories. One is time intensive, need more time. The other is more resources demanding. So we find very consistent with the economics literature. The highly educated children, their time cost is high, and they tend to be living away from their parents, but they send more financial support. But for those who are lower educated children, they offer more informal care. They assist their parents in decision making, like pension, health insurance, and they reduce their parents' burden in taking care of the grandchildren. So one is specialized in the time time incentive support. The other is more concentrated on resources intensive care. But I would say that that's the last short slide. Although this is wonderful, there's a wonderful within family arrangement of caring for parents, but we should be very cautious about what's happening in recent years, especially many of you already seeing the news coming out, the fertility rate is reducing, and there are 2 baby boomer cohorts in China are getting older. And the shrinking children, not only from the late, longer, fewer policies when they are becoming adults, they are supporting their parents, but the one-child policy could have a major implication in having fewer children to support their parents. So far, if you look at the total fertility rate for China, it's below like 2, right, on average. And since we are studied within family coordination of care for parents, but that's conditional on you have 2 children. But gradually we will not be in this situation. So the children will both provide time incentive care as well as resources incentive care. That will be very demanding for the younger generation, and also a very bad news for parents who really seek all kinds of different support. And also this study, the final thoughts is that we only look at the years of education. There are more and more studies coming out, especially in American setting. For example, one by Jennifer Manny in Colombia, and she has been documenting and digitizing the historic data for American school district to look at the quality of education. I think that's very important next step to look at the effect of education on health or on parents' health. Education quality really matters. And there are some other studies which can, so far we look at the compulsory schooling law, which mainly affect the people's completion of junior high school. But we should look at the different cutoff points. For example, the finishing of the primary school or finishing of the college. So for example, in America, the Perry Preschool Project or Project STAR give us opportunity to look at earlier education, how that have a long-term impact on the children themselves and their parents. So which can help us distinguish the linear education health linkage from the, we call the credential effect. Is it because of the year of education really matters to health, or because of the level, the diploma the children receive that may affect their support for their parents? I think those are unanswered questions. So that's why there's no wonder Michael Grossman was mentioning this is still very much place-based, context-based, and policy-based, depending policy debate, and lots of things are unanswered yet. Thank you so much.
Thank you, Professor Chen. This is very fascinating and such a robust study. I really appreciate you showing us the background and the international context of this topic. And this new study is really amazing. So thank you.